Welcome to this video on the proposed mechanism of action of MAVENCLAD in the treatment of multiple sclerosis. Before we begin, let's review the indication and some important safety information. Indication: MAVENCLAD, cladribine, tablets, is indicated for the treatment of relapsing forms of multiple sclerosis to include relapsing remitting disease and active secondary progressive disease in adults. Because of its safety profile, use of MAVENCLAD is generally recommended for patients who have had an inadequate response to or are unable to tolerate an alternate drug indicated for the treatment of MS. Limitations of use: MAVENCLAD is not recommended for use in patients with clinically isolated syndrome because of its safety profile. Important safety information: warning regarding malignancies and risk of teratogenicity. Treatment with MAVENCLAD may increase the risk of malignancy. MAVENCLAD is contraindicated in patients with current malignancy. In patients with prior malignancy, evaluate the benefits and risks of the use of MAVENCLAD on an individual basis. Follow standard cancer screening guidelines in patients treated with MAVENCLAD. MAVENCLAD is contraindicated for use in pregnant women and in women and men of reproductive potential who do not plan to use effective contraception because of the potential for fetal harm. Malformations and embryo lethality occurred in animals. Exclude pregnancy before the start of treatment with MAVENCLAD in females of reproductive potential. Advise females and males of reproductive potential to use effective contraception during MAVENCLAD dosing and for 6 months after the last dose in each treatment course. Stop MAVENCLAD if the patient becomes pregnant. Please see additional important safety information at the end of the video. Find the full prescribing information at mavenclad.com/HCP or at the end of this presentation. Many drugs utilized in the treatment of multiple sclerosis must be administered continuously to produce efficacy. MAVENCLAD, which is cladribine tablets, is thought to work differently. A clinical trial has demonstrated that the therapeutic efficacy of a short-course treatment with MAVENCLAD extends beyond the dosing period. MAVENCLAD is administered at home in 2 treatment courses, each one over 4 to 5 days in months 1 and 2 of treatment year 1 and in months 1 and 2 of treatment year 2. Before initiating MAVENCLAD, follow standard cancer screening guidelines because of the risk of malignancies, exclude pregnancy because of the risk of fetal harm, obtain a CBC with differential including lymphocyte count, screen for infections, and assess hepatic function. A clinical trial has demonstrated that the clinical efficacy of MAVENCLAD can extend beyond the dosing period for up to 96 weeks. After the completion of 2 treatment courses, do not administer additional MAVENCLAD during the next 2 years. How is MAVENCLAD proposed to work? The mechanism by which cladribine exerts its therapeutic effects in patients with multiple sclerosis has not been fully elucidated. It is well established that in MS there is abnormal immune activation, resulting in autoreactivity of B and T lymphocytes that causes neuroinflammation. MAVENCLAD treatment is associated with a reduction in lymphocyte count and a subsequent recovery of the lymphocyte count. In fact, studies have shown that in most patients there was reduction of both B and T lymphocyte counts. This was followed by recovery of the total lymphocyte count in most patients. While not returning to pre-treatment levels, by 96 weeks, total lymphocyte count returned to at least 800 cells per microliter in 88% of patients in a post-hoc analysis. Although lymphocyte reduction continues for several months, after the last dose, cladribine is eliminated from the body in approximately 1 week. Let's look at median lymphocyte counts measured in pooled data from Clarity, Clarity Extension, and Premier. After administration of MAVENCLAD in treatment years 1 and 2, there was a lymphocyte reduction, which was followed by a lymphocyte recovery in most patients. In clinical studies, 87% of MAVENCLAD-treated patients experienced lymphopenia. The lowest absolute lymphocyte counts occurred approximately 2 to 3 months after the start of each treatment course and were lower with the second treatment course. Monitor lymphocyte counts before and during treatment, periodically thereafter, and when clinically indicated. In patients treated with MAVENCLAD 3.5 mg per kilogram as monotherapy, lymphopenia was mostly mild to moderate. In a post-hoc analysis, the lymphocyte levels reached nadir at week 13, where 1.3% of patients had grade 3 or 4 lymphopenia, while 82.2% remained at normal to grade 1. For the second treatment year, lymphocyte levels reached nadir at week 54, with 6.7% of patients in a grade 3 or 4 lymphopenia and 64.5% at normal to grade 1. Over 96 weeks of patients who experienced lymphopenia, 73% had grade 1 or 2. 26% of patients experienced grade 3 lymphopenia, and only 1% experienced grade 4 lymphopenia. At the end of the second treatment course, 2% of clinical study patients had grade 3 or 4 lymphopenia. Overall, the median duration of severe lymphopenia was 6 weeks to improvement to grade 2 or less, and 28 weeks to recovery to grade 1 or less. In general, mild to moderate decreases in neutrophils and monocytes were observed, and the median levels remained within the normal range throughout the treatment period. Severe decreases in neutrophil counts were observed in 3.6% of MAVENCLAD-treated patients, compared to 2.8% of placebo patients. Vaccination can be considered until 4 to 6 weeks prior to starting each MAVENCLAD course if white blood cell counts are within normal limits. Please see Section 5.4 of Prescribing Information for details regarding vaccination. What is thought to underlie the preferential effect of cladribine on lymphocytes? Cladribine is a prodrug. Inactive cladribine enters cells and is activated by specific kinases. It is also deactivated by specific phosphatases. B and T lymphocytes have a higher kinase to phosphatase ratio than other cells, such as innate immune cells and cells in other body tissues. This results in activated cladribine preferentially accumulating inside lymphocytes. Activated cladribine is thought to deplete B and T lymphocytes through cytotoxic effects by impairing DNA synthesis. This is the hypothesized mechanism by which MAVENCLAD achieves preferential reduction of lymphocytes, which are known to play a key role in the development of multiple sclerosis. The half-life of cladribine is about 24 hours, and therefore it is virtually eliminated from the body within approximately 1 week. MAVENCLAD represents EMD Serono's strong commitment to advanced treatments for multiple sclerosis. To learn more, please visit mavenclad.com/HCP. Important safety information. Contraindications. Patients with current malignancy, pregnant women, and women and men of reproductive potential who do not plan to use effective contraception during and for 6 months after the last dose in each treatment course may cause fetal harm. Patients with human immunodeficiency virus, HIV, patients with active chronic infections, for example, hepatitis or tuberculosis, patients with a history of hypersensitivity to cladribine, women intending to breastfeed while taking MAVENCLAD tablets and for 10 days after the last dose. Warnings and precautions. Malignancies. Treatment with MAVENCLAD may increase the risk of malignancy. After the completion of 2 treatment courses, do not administer additional MAVENCLAD treatment during the next 2 years. The risk of malignancy with reinitiating MAVENCLAD more than 2 years after the completion of 2 treatment courses has not been studied. Follow standard cancer screening guidelines in patients treated with MAVENCLAD. Risk of teratogenicity. MAVENCLAD may cause fetal harm when administered to pregnant women. In females of reproductive potential, exclude pregnancy before initiation of each treatment course of MAVENCLAD and prevent by the use of effective contraception during MAVENCLAD dosing and for at least 6 months after the last dose of each treatment course. Women who become pregnant during treatment with MAVENCLAD should discontinue treatment. Lymphopenia. MAVENCLAD causes a dose-dependent reduction in lymphocyte count. In clinical studies, 87% of MAVENCLAD-treated patients experienced lymphopenia. The lowest absolute lymphocyte counts occurred approximately 2 to 3 months after the start of each treatment course and were lower with each additional treatment course. Concomitant use of MAVENCLAD with hematotoxic drugs may increase the risk of adverse reactions because of the additive hematological effects. Monitor lymphocyte counts before and during treatment, periodically thereafter, and when clinically indicated. Infections. MAVENCLAD can reduce the body's immune defense and may increase the likelihood of infections. Infections occur in 49% of MAVENCLAD-treated patients compared to 44% of patients treated with placebo in clinical studies. The most frequent serious infections included herpes zoster and pyelonephritis. Single fatal cases of tuberculosis and fulminant hepatitis B were reported in the clinical program. Administer live attenuated or live vaccines at least 4 to 6 weeks prior to starting MAVENCLAD. Screen patients for latent infections. Consider delaying treatment until infection is fully controlled. Vaccinate patients antibody negative to varicella zoster virus prior to treatment. Administer anti-herpes prophylaxis in patients with lymphocyte counts less than 200 cells per microliter. Monitor for infections. In patients treated with parenteral cladribine for oncologic indications, cases of progressive multifocal leukoencephalopathy, PML, have been reported. No case of PML has been reported in clinical studies of cladribine in patients with MS. Hematologic toxicity. In addition to lymphopenia, decreases in other blood cells and hematological parameters have been reported with MAVENCLAD in clinical studies. In general, mild to moderate decreases in neutrophil counts, hemoglobin levels, and platelet counts were observed. Severe decreases in neutrophil counts were observed in 3.6% of MAVENCLAD-treated patients compared to 2.8% of placebo patients. Obtain complete blood count, CBC, with differential, including lymphocyte count, before and during treatment, periodically thereafter, and when clinically indicated. Risk of graft versus host disease with blood transfusions. Transfusion-associated graft versus host disease has been observed rarely after transfusion of non-irradiated blood in patients treated with cladribine for non-MS treatment indications. Liver injury. In clinical studies, 0.3% of MAVENCLAD-treated patients had liver injury, serious or causing treatment discontinuation, compared to 0 placebo patients. Obtain serum aminotransferase, alkaline phosphatase, and total bilirubin levels prior to treatment. Discontinue if clinically significant injury is suspected. Hypersensitivity. In clinical studies, 11% of MAVENCLAD-treated patients had hypersensitivity reactions, compared to 7% of placebo patients. Hypersensitivity reactions that were serious and/or led to discontinuation of MAVENCLAD occurred in 0.5% of MAVENCLAD-treated patients, compared to 0.1% of placebo patients. If a hypersensitivity reaction is suspected, discontinue MAVENCLAD therapy. Do not use MAVENCLAD in patients with a history of hypersensitivity to cladribine. Cardiac failure. In clinical studies, one MAVENCLAD-treated patient experienced life-threatening acute cardiac failure with myocarditis, which improved after approximately 1 week. Cases of cardiac failure have also been reported with parenteral cladribine used for treatment indications other than multiple sclerosis. Adverse reactions. The most common adverse reactions with an incidence of greater than 20% for MAVENCLAD are upper respiratory tract infection, headache, and lymphopenia. Drug interactions, concomitant medication. Concomitant use of MAVENCLAD with immunosuppressive or myelosuppressive drugs and some immunomodulatory drugs, for example interferon beta, is not recommended and may increase the risk of adverse reactions. Acute short-term therapy with corticosteroids can be administered. Avoid concomitant use of certain antiviral and antiretroviral drugs. Avoid concomitant use of BCRP or ENT-CNT inhibitors, as they may alter bioavailability of MAVENCLAD. Use in specific populations. Studies have not been performed in pediatric or elderly patients, pregnant or breastfeeding women. Use in patients with moderate to severe renal or hepatic impairment is not recommended. Please see the full prescribing information at mavenclad.com/HCP or at the end of this presentation.